It is only natural that the coronavirus and the economic pain that it's causing is making a lot of people anxious. And there's actually polling that validates it. A new poll out taken just a few days ago shows that the majority of people asked say their mental health has not changed yet, and that really over the past week. But when you boil the numbers down, women more anxious than men, and younger people, surprisingly, even more upset than seniors. I want to bring in our guest, Dr. Jeff Gardere. He's a psychologist with a practice in Manhattan. He's also an associate professor of behavioral medicine at Touro College in New York City. Doctor, as always, I appreciate the time.
Thank you, Richard.
I want to get into what you're starting to already see and maybe some counsel that you can give to our audience. But I have a question as it relates to the population of the mentally ill with all of these unintended consequences with the pandemic, and that is what happens when people need to see their psychiatrist or psychologist? What happens, for example, at mental health facilities where you have large clusters of people, which run counter, obviously, to the idea of trying to create spacing? I would imagine visitation even at these facilities has been curbed, if not stopped. What are you seeing as to some of the consequences this virus has brought that maybe this community has never had to deal with?
I think it's important that what we've started doing, and this has been in many ways promoted by the American Psychological Association, is the idea of telepsychology and telepsychiatry, telemedicine. So instead of having patients coming in, we want them to practice that social distancing. So what we do is we have them join us on one of the video apps or some sort of a platform where we can actually continue the therapy. And let me tell you, it's important that we continue the therapy, continue the psychiatric medications, because this is a population, a mental health population, that is already under normally undue stress, if you will. And now with COVID-19, the pandemic, now it's making things even more difficult for that particular population, as well as all populations.
I would imagine another concern that's obviously not relegated to the mentally ill, but I'm hearing at least some concerns that pharmaceutically, that there could be backlogs with other nations that produce some of the elements of these products necessary. And obviously for anyone who's clinically depressed or name whatever the psychosis that they may be even dealing with, that's also got to be a concern, let alone diagnosing people, whether it be for treatment or prescriptions or whatever the case may be. You can do a lot, as you said, online with someone, but there are some things I imagine that an in-person consultation is critical for.
Yeah, absolutely. And especially if there may be an issue with the psychiatric meds, we have to be really cognizant that there are people, for example, with schizophrenia, people with bipolar disease, people perhaps with a very, very deep severe clinical depression. So therapy alone, psychotherapy alone is not going to do it. These folks need to be on their medications. The psychiatrist in this particular case, or psychiatric nurse practitioners or family practitioners, make sure that they stock up on these medications in case we all go into some sort of seclusion for the next couple of months, or we can't get these medications, that they are available.
For much of my audience, I'm sure they're dealing with this reality like many of us are, which is you got kids right now who are getting stir crazy. And there's a certain point where schools have either begun or haven't begun yet. And I can speak from personal experience with the online teaching with these kids and everything attached to it. I've heard two different schools of thought. One is get them into a routine, and the other is they got enough stress it is, leave them alone and let them basically goof off or do whatever they're going to do here. They don't need more on their plate. Which school do you fall in?
What I do with my kids and what I've recommended to the parents that I work with is try to keep as much as possible an environment that mirrors what our kids had with school. So that means a very exact wake up time. If they woke up at 7 in the morning to go to school, then they wake up at 7 in the morning, have their breakfast, do their exercise, and then go right into their schoolwork. Even the school packets, try to do them in the same order that they were actually taking their classes, taking the quizzes, and then ending at 3 or 4 o'clock as they did when they were in school. Making sure that they're not walking around in just pajamas, because I think that tends to make us lazy psychologically. And those of us who are now working at home can use some of those same lessons.
And then let me go to the opposite end of the age spectrum, and those are seniors. Now, you know, the isolation that seniors, a lot of them may deal with, even those with families that don't want to risk their health by unknowingly carrying something that could be fatal to a senior. I got to imagine for this population, I know, for example, at senior living, assisted living facilities, they're banning visitors to come. It's got to be something top of mind here, that for a population that oftentimes feels ignored to begin with, to further basically isolate them from everyone else, that's got to be a real concern.
Richard, you're right on it with this. This is a big, big concern amongst many people I've spoken to who have loved ones in assisted facilities, in nursing homes, in hospice, who are about to die, and we want to spend that time with them, but we can't. I think it puts a lot of guilt and pressure on us to not be able to see those people, the elders. These facilities are doing the right thing by saying you can't visit because, our residents are now at risk as far as COVID-19 and other illnesses. So this is where we use social media. This is where you use Skype and FaceTime and other ways to stay in contact with them with the cooperation of these institutions as much as possible.
Dr. Gardere, I know you probably charge quite a bit for an hour, but I think my audience got you on the cheap today. You had some great advice. I really appreciate the time. Thank you so much.
And thank you for your great questions and concern. Good luck in everything.
You as well. All right, everyone, we will take a quick commercial break. When we come back, we'll wrap things up.